Hello, my name is Matthew Hood. I'm the Vice President of Government Relations at Dartmouth-Hitchcock, and I'm so pleased today to welcome the candidates and viewers to our latest iteration of Health Policy Grand Rounds, which is a component of Dartmouth-Hitchcock's We Care, We Vote, which is a nonpartisan voter education effort. We Care, We Vote is designed to inform and encourage people to vote, not to direct to whom they vote for. Again, I'm so pleased to host the candidates for Senate District 5 seat, which of course DHMC sits right in the center of. I'd remind people that the primary is September 8th, rapidly approaching, and voting has been made more accessible for 2020 in light of COVID. Resources for registering and voting absentee can be found on the Government Relations website on Dartmouth-Hitchcock's internet. So, our candidates. Sue Prentice of Lebanon is the Executive Director of the American Trauma Society and has extensive experience in the fields of public health and safety. She is serving her 6th term as Lebanon City Councilor, 2 of which she served as mayor. Welcome, Sue.
Thank you, Matthew.
Beatrice Pastor of Lyme is a professor of Spanish and Portuguese languages and comparative literature at Dartmouth College. She served 3 terms in the New Hampshire House of Representatives, where she sat on the Science, Energy, and Technology Committee. Welcome, Beatrice.
Thank you, Matthew.
Both, I should note, have been recognized for work in their respective fields, have served their communities with dedication and distinction, and Senate District 5 is lucky to have them step forward to run for the state Senate. Before jumping in, I wanted to thank Courtney Tanner, my colleague, Director of Government Relations at Dartmouth-Hitchcock, and the people in communications and marketing at Dartmouth-Hitchcock behind the scenes for making today's event possible. Thank you. So today, the format has been discussed previously. We're going to have a series of questions that each candidate will have an opportunity to answer, in addition to opening and closing statements. And I'm going to ask Sue Prentice to start with the opening statement. Welcome again, and thank you, Sue.
Thank you, Matthew, and good afternoon. I'd like to thank DHMC for providing this forum. Again, I'm Sue Prentice. I'm a paramedic, Lebanon City Councilor, a former mayor, and the former chief of emergency medical services for the state of New Hampshire. I'd like to congratulate DHMC for performing its 1,000th organ transplant last week. Tongue-tied. We're in the midst, serious business here, of multiple crises, including public health, climate change, and racial and economic justice. COVID-19 was my tipping point and why I decided to run. I'm worried. I know my 30 years of experience in protecting the public, in managing crises, has prepared me uniquely to be a leader in the Senate at this time. Protecting vulnerable people is a core value of mine. In fact, it's why I've devoted my career to public service, and it's why I'm a Democrat. I came to the Connecticut River Valley in 1992 as a director of the Rural Health Outreach Project at Dartmouth Medical School. So shoring up the primary healthcare safety net was our mission. We knew that residents of rural communities did not have equal access to healthcare, and many times did not have transportation. An ambulance may have been their only way for access. I taught EMS training courses in Coos, Grafton, and in Sullivan counties, and worked to elevate the level of care available in some of the most remote areas of our state. When working in state government, I coordinated our trauma system development, working closely with program leaders at DHMC before being promoted as the first female chief of EMS. After leaving state government, I continued to promote progressive approaches to community health as the manager of EMS at Concord Hospital. In response to the growing mental health crisis and inadequate state funding, I worked with Concord Fire Department and Riverbend Mental Health Services in the development of the mobile crisis response teams that shifted the paradigm from law enforcement response to people in crisis to a community health approach. Ambulances and police officers are now able to take people in crisis to outpatient mental health clinics as appropriate in other locations where they can get the specific help they need instead of sometimes a lengthy and unnecessary emergency department stay. My desire to serve my community led me to run for the City Council, where I have served for the past 11 years, championing and voting for a progressive agenda as a nonpartisan City Councilor and Mayor. I led the vote on anti-discrimination protections for transgender employees, spearheaded the city's first inclusiveness resolution in 2017 in response to racist hate speech, and I have fought consistently against climate change by adopting the goals of the Paris Climate Accord and supporting investments in alternative energy. I was on the front lines of New Hampshire's response to both SARS and H1N1, Specifically in H1N1, I played a role in developing the plans for the deployment of our vaccine through our state's 13 public health networks. Fully reopening our economy, our schools, and our communities will depend on a rapid, comprehensive deployment of a COVID vaccine when it becomes available. In fact, we can use this upcoming flu season as a dry run to test our systems and prepare ourselves for what comes next. I am also not a stranger to the New Hampshire legislature. When I worked as the chief of EMS, I helped draft legislation, identify sponsors, testify before committees. From 2016 to 2018, my work on EMS licensing policies took me to different states to build coalitions, to get a specific piece of legislation introduced, testify before committees, and shepherd the bills through the process. 9 of these bills passed in that time, meaning that I was able to get on the ground, up to speed with multiple state legislatures. Most important to me right now is the opportunity we have to right the wrongs, to address the inequalities that face us head on, while at the same time managing the state's largest response to a public health emergency. I'll fight for the long overdue fair funding of schools or public education, a meaningful response to climate crisis that builds on our local efforts. I'll fight for racial, social, and economic justice. I'm that crisis manager for this critical time to help build an inclusive, more prosperous New Hampshire. Thank you.
Thank you, Sue. Beatrice, your opportunity for the opening statement.
Hello, everyone. Thank you so much, Matthew and the team, for inviting us and giving us this opportunity to speak to all of you. It is a pleasure to be here. I am Beatriz Pastor. I am a professor at Dartmouth College. I have been teaching all my life, most of it at Dartmouth College. I have an accent and my name is spelled in a weird way, but that's because I am originally from Spain. I came to this country as a student and I stayed. I am running for the Senate after having served on the House for 3 consecutive terms, from 2008 to 2014. And I am running on my record. I am a lifelong Democrat. I have a lifelong commitment to call progressive democratic issues, values, and agendas. My record in the House for those 6 years shows exactly that. I have sponsored and co-sponsored bills having to do with, health care, affordability, and Medicaid expansion, social justice, criminal justice, women's reproductive rights, Planned Parenthood, I mean, you name it. And my main focus, though, has been on energy issues, because one of my top concerns is climate action. For that reason, I chose to serve in the Science, Technology, and Energy Committee, and from there, I sponsored some of my major bills. My 3 terms in the House demonstrate that commitment to core progressive democratic values and agendas, and they also demonstrate just how effective I am in fighting for them. Now, why I'm running for the Senate right now? I'm not running because of the pandemic. I mean, there are many crises, and the issues that decided me to run preceded the pandemic. They were the same issues that led me to run to the House. They have to do with a number of deficiencies that I see in the state. I love the state. I feel that there is a lot to be done, and I want to get it done. I'm thinking about education when I think about those issues, and the absolutely inequitable system of education that we have in the state, based on a heavy reliance on property taxes that immediately divides the areas into areas where children have access to good education and low property value based areas where children do not. I'm thinking about healthcare, with areas that are well served, with good access, but high costs everywhere, in areas that are barely served, if not served at all. I'm thinking about growth and development. And just to name one thing, broadband. I was already fighting for broadband in the House, and I will continue to fight for broadband now, because at least now everybody realizes that it was then and it is now a key tool for economic growth and prosperity. And finally, there is climate change, of course. And I see that we have a state government that is not too enthusiastic about pushing the measures that are crucial to ensure that we fight climate change effectively and that we meet our goals of carbon neutrality and a complete switch to renewables by the dates that we have picked. I worked for all those issues when I was in the House. I worked there very effectively, and I will continue to work on them from the Senate. So, this is a hard time, and the pandemic is on everybody's minds. But I'll tell you one thing. with big crises come big opportunities. And I think that now we do have one of those opportunities because people have become much more aware of the urgency that we have in fixing those deficiencies. Not just broadband, all the others, healthcare access, healthcare costs, economic recovery, equitable development, social justice, all those things are now in everybody's mind. And for that reason, I think we have the opportunity to move aggressively and move for real change. And that's what I'm planning to do from the Senate. Thank you.
Thank you, Beatrice. And now we're going to move into the questions portion of the conversation. And I'm going to start with Beatrice. Beatrice, you had actually mentioned healthcare costs, I think, multiple times. And so with respect to healthcare coverage, COVID-19 has impacted many Granite Staters in a number of ways. Specifically, for many who have been laid off or let go, it's resulted in a loss of health coverage, for themselves and in many cases their families. What policy changes would you advocate for to ensure people and families are not without healthcare coverage in a time of need?
Well, first of all, this notion that your health care and your health insurance is tied to your job is extremely problematical. I think that this is something that we have to address on an emergency basis right now, but at a national level, long term. I see the impact that COVID has had on the receiving end, on the patient's end. I also see the impact it has had on hospitals. And the issue of what kind of things are going to be covered as an emergency measure in relation to the health crisis created by the pandemic is an important issue that I think we need to look at from the Senate. One of the issues that are worrisome is the fact that the legislature did not wait until next year to do something about that pandemic. There were a number of Senate bills that were addressing those issues, that were addressing economic issues like mortgage defaulting and rent defaulting, that were addressing specific appropriations to cover expenses related to COVID in nursing homes and in people who had lost their health coverage. And the unfortunate thing is that they all got vetoed by the governor. But I think that we have to continue the push. I say we have to guarantee from the Senate and from the legislature that people who are left without health insurance because of the loss of a job due to COVID will be covered and will not lose their health benefits, because health care is a right. It's not just a choice. And I think that it is the responsibility of the state and the responsibility of the legislature to make sure that that right is honored and that people are covered regardless their employment circumstances.
Thank you, Beatrice. And Sue, the same question to you. What policy changes would you advocate for to ensure people and families are not without health coverage in a time of need?
So healthcare, access to healthcare, quality and affordable, is about justice. It is about equality. In what we know right now, what we know is that this is a basic human right that needs to be met. I've spent the majority of my career working in the healthcare field and have actually worked in emergency departments and coordinated with inpatient units where I have seen members of the communities we serve that didn't have healthcare. And saw them come to the emergency department when they were the sickest that they possibly could have been because there wasn't a primary care or a preventative option for them, which drove up the cost of their care and also the length of their stay, which all impacts the overall costs of healthcare. Let's narrow this down and talk about COVID. So one, disproportionately impacted folks, impacted communities of color in terms of illness and their susceptibility to this virus. And then the second is that unemployed group. 94,000 New Hampshire residents are without healthcare coverage because of COVID. So our ability to address this is gonna be in an emergency type of action. We're gonna need to extend, either drop the cap on the Medicaid drop the ceiling on Medicaid so that more people can enroll in it. We also, for the benefit of the institutions, I mean, number one is the people. So getting them access, emergency access, whether through Medicaid or another extension program that's provided through Health and Human Services enabled by the legislature, that would be the priority. At the same time, we also need to look at raising rates for Medicaid reimbursement or related reimbursement for institutions who have also suffered during this time. The third would be around just continuing to increase this access with telehealth. We've seen this with broadband. You know, we have this hole with broadband. We're working to fill that, but telehealth has filled a significant role in patients being able to be seen during this time. It doesn't fill the role of whether they have insurance or not, but it does improve access. So wrapping this up, we have to have a way to provide emergency access. We know we have 94,000 residents of New Hampshire who are without insurance right now that we need to provide emergency assistance for. We need to make sure that they're not in a position where they're going to get any, you know, they're going to be more disproportionately impacted by this virus or any other potential condition. And I think we should be looking at how we can help the institutions get through this time so they can not only survive, but ultimately thrive. Thank you.
Thank you, Sue. So I want to thank you both, by the way, for providing wonderful segue opportunities. So my next question is going to pivot a little bit to Sue, something that you would, and Sue, this question goes to you first. Something that you mentioned in the introduction, I believe, and this question pertains to the social determinants of health and public health. We know that more than 80% of healthcare costs are driven by factors that we can't control within the walls of a doctor's office or a hospital. Social determinants of health drive quality of life and health outcomes. Factors include income, social status, education, employment, childhood experience, housing, social supports, etc. How do you see the New Hampshire legislature's role in impacting social determinants of granite staters? And if elected, what of those would you work on advancing?
In terms of each of the different determinants or just in general, Matthew?
Sorry, so in general, and if there are particular ones that you feel compelled or have a policy desire to address, that would be great. I don't expect you to tackle the laundry list that either of you to tackle the laundry list I just gave. I was just giving by example the social determinants, but specifically, maybe I'll ask this question more clearly in two frames. One is, can you speak to social determinants in general and the role of the legislature in impacting them? And then second, if there are particular social determinants that you have a plan to address, if you could share that, that would be great.
So in talking about social determinants of health, where I've worked the most with those is along the lines of injury prevention, because they are predictors of where we're going to see the potential for injuries that we can prevent, not just in New Hampshire, but throughout the country. So when I think about this, two of the areas that I want to particularly work on would be in the areas of the racial disparities, as well as the underinsured and the economic disparities. I think that's where we could have some of the greatest impacts. The idea here is to be able to advance a healthcare system that has access, that is affordable and provides quality. And the groups that you mentioned when you were laying out some of the different categories of social determinants of health are traditionally underserved and have different reasons within each of those for that. So if we, as a legislature, stop waiting for the federal government and start moving forward in a purposeful way and bringing about a public option, we can work on prevention. Working on prevention actually drives down costs. Prior to COVID, the leading cause of death in our country is trauma. That is, between the ages of 1 and 44. Now, it has not surpassed that in terms of New Hampshire for COVID, but that's a place where we've been solidly working on the social determinants of health in our efforts to drop the injuries and to contain the costs, but most importantly, to take care of the members of our community. So when we think about impacting all these different areas, we need to stop waiting for the federal government. We need to act on each one of them by bringing about a public option, one that we can all agree on and advance in a meaningful way.
Thank you, Sue. So Beatrice, I'm gonna ask the same question to you. I'm gonna try to articulate it as similarly as I can. One is, how do you see the legislature's role in addressing social determinants of health writ large? And then if there's a particular social determinant or two that you have particular interest in addressing. Could you speak to that?
Look, social determinants have to be addressed in a cohesive way. You're not just talking about one thing. I think that you're talking about the safety net that the state provides for everyone. Because with a strong, your tightly woven safety net, a lot of the social determinants can be, mitigated and sometimes offset. I think that it is of course great to aspire at a public option, and I do think that would solve, the problem long term. But I think that we need to do things more quickly. I don't think that we're going to get that public option tomorrow, and I think we need to address those things today, because that's the nature of the crisis. I think that without having to go through the whole process of having a public option approved, I think that the state could take some steps that might help a lot. There are already some game changers that are going to, I think, make the landscape of health delivery much more equitable across those social determinants. If we think about, for instance, telehealth can help. Now that it's not just telehealth through broadband, but also through the phone, thanks to a bill that just passed the Senate this year, that means that people who don't have access to broadband still have that link that allows them to have consultations and get medical care, long distance, like from the North Country where broadband coverage is really a problem. But in addition to that, I think that we need to make a big push for two things. One of them is community-based care. The other one is home-based care. I think that we need to train that workforce that can provide those services more locally, so that, number one, everybody, regardless those social determinants, has access, close access to healthcare, and number two, so that the hospitals are not overburdened, which now they are. And the thing is that, increasing the Medicaid reimbursement is a crucial measure to make sure that financially the hospitals can work and can function and can prosper. But at the local level, I think that improving the network of local health delivery would go a long way towards both helping out people who are dealing with some of those negative social determinants and helping hospitals who have to provide health across the board and for so many different populations and areas.
Thank you, Beatrice. So I'm going to pivot a little bit in the questioning, and I'm starting with Beatrice on this question pertaining to workforce. New Hampshire is bracing for what's been called the silver tsunami. As baby boomers age and leave the workforce, it will be imperative for New Hampshire to attract and retain young professionals, not just in healthcare, but across all sectors. How will you work to attract and retain young professionals and their families to New Hampshire?
Well, that is a long-standing problem, and it's something that has worried me for a long time. I mean, I have children. I've raised 4 children in New Hampshire. Guess how many of them are still living in the state? None. And that tells you something. This is not an isolated case. We have a problem with young people leaving the state, and we have a problem attracting, people from other states in order for them to move to New Hampshire. I think that there are a lot of things that can be done and a lot of things that are being done already. I think that one of the reasons why we have trouble developing the kind of in-state workforce that we need has to do with college funding and college education. The fact that college is very expensive, the fact that students graduate with a very high debt, and the fact that the offerings of training are not as diversified as they should be. I think that the community college network needs to be strengthened so that we offer more educational opportunities for young people in our state. But in addition to that, there are other issues that are really important and that can be dealt with, hand in hand with the cost issue. Partnerships will help with the cost issue. I mean, right now already Dartmouth-Hitchcock has partnerships that allow them to pay for the tuition of students who go to college in River Valley Community College or in Colby Sawyer, and Dartmouth-Hitchcock will pay for the tuition, and in exchange, the students will come and work for a number of years at Dartmouth College. Debt forgiveness is one form to do that. That kind of exchange is another form. Employers picking up the debt is another form, but something has to happen. so that number one, our young people get trained in the state, they have the training opportunities that they want, and that prepare them to create the new workforce that we need as our generation ages, and that can be done in state through a complete rethinking of educational programs and opportunities, and then the kind of support that businesses can provide to college graduating seniors, so that they can complete their degrees, get ready for their profession, to be productive members of society, and at the same time, not drown in debt and begin a career working for the same people who have sponsored them from the beginning. So I think that would go a long way in allowing a lot of young people to stay here. I think that it would also make it more attractive to people from out of state to come to this state, and that it would make a big difference. There are other issues that I haven't mentioned and that still need solving, but I think that starting with the debt, starting with the college opportunities, starting with the partnerships between colleges and businesses would be a very good way to increase the retention and the development of our workforce.
Thank you, Beatrice. Sue, the same question to you. How would you work to attract and retain young professionals and their families in New Hampshire?
So I'm going to start with the last chapter first to get back to it. Remember, stay, work, play. And I know that's a program, but it means something for a reason. This is about building a prosperous, more inclusive New Hampshire. And it starts with early childhood education. We're one of 5 states in the nation that does not have early childhood education. So our children go into an educational system that is not equally, adequately, and fairly funded. We want not just an adequate, we want an excellent education. And then they come out as young adults with limited trajectories. So we have 2 approaches to this. The long-term approach is we're going to have to right the ship, is dealing with early education, preparing children for success at 6 as they come into the schools. But the outside of this, and to prevent the outmigration, is talking about the young adults. So when they graduate, college may be a track that they choose, a trade may be a track that they choose, the military. All of what we do in the middle with properly funding and having an excellent education is going to promote this. So let's talk about the workforce. Workforce development should start in high school. Trade schools should be forming partnerships with high schools, be more readily available in the state of New Hampshire, so that students can start to try out what they are interested in, little on-the-job training, and have apprenticeship tracks through to graduation and be lined up for a job. A skilled workforce is what I continue to hear, not just from folks in Grafton County, but in Sullivan County. They are in need of a skilled workforce. There are jobs that need to be filled. So trade schools, community colleges, but let's talk about the stay, work, play part of this. The stay, in order to prevent the outmigration, after we deal with the educational issues, is having affordable housing. So giving communities the zoning tools that they need to be creative in order to have affordable housing for those who are gonna stay here and gonna work here. In terms of working, again, that goes in workforce development, the tracks from in school to out of school, trying out what they're interested in and being able to make that their career should they choose. My mother, 88-year-old mother, often says to my daughter, you should have been a plumber, because there's lots of jobs for plumbers. She graduated from St. Michael's and she's a recruiter, but my 88-year-old mother has that wisdom. And last is going to be play. The quality of life, we hear from communities all of the time, especially in Lebanon. Folks say, I want to live close to downtown, I want activities. And so we had the Arts and Culture Task Force and built a commission. We coordinate different arts and culture related activities, from performing arts through to music lessons, as well as having a robust recreation department. So in order to prevent, and wrapping this, the outmigration, we need to have affordable housing, we need to have workforce development tracks and investing in our trade schools, and we need, in terms of play, to build the quality of life on the local level that keeps our folks, our young adults in the state of New Hampshire. Thank you.
Thank you, Sue. So you both actually mentioned education in your answer to the last question, and I'm gonna dive a little bit deeper into the education question in a particular. So last spring, the state announced, the governor Sununu announced that all public schools would commence remote only learning. children remained at home during for the balance of the school year, and now schools are working on plans for the coming school year. There's not a universal approach to what school districts are doing. Some are returning to school in masks, some are remaining remote only, some are doing a hybrid of both. So my question is again twofold. The first part is, should New Hampshire have a universal approach to the 2021 academic year? And then the second part is, what resources should New Hampshire state government provide to school districts as they plan to reopen? And I believe that question goes to Sue first.
I thought, but I wanted to just make sure.
Yep.
Okay, so would I prefer a universal approach? Yeah, yes. But that, as we say in some of the more rural parts of the state, that cow's already out of the barn. So what we're facing is our differences community to community. That's being driven by teachers, being driven by parents. In some communities, the inclusion of scientists, pediatricians, bringing some of the experts that bring the evidence to the table to talk about, if they're gonna go back, the best way to go back. That's really been, that's the approach that's been taken district to district, and I can support that. A universal approach would have been my preference, but in New Hampshire, every community is different. And again, these groups are getting together, parents, teachers, scientists, pediatricians, and working through what's the best approach for their community. Broadband is going to be key in this. And then I want to talk about the downshifting of costs, because in broadband, having broadband available is the only way that we are going to be able to, if we go remote and we go remote again, or we're using a hybrid model, we have to have equal and fair access. This is an infrastructure asset that's not adequately and widely available in the state, and it really impedes the ability of school districts' choices when moving forward. I had the opportunity to tour all the schools in the Mascoma Regional Valley School District right at the time when they had gotten guidance from the state and they started setting up model classrooms, and they were talking to parents and trying to decide how they were gonna return and what it might look like. So a new level of complexity, but again, teachers, principals, and families were all involved in these discussions. But here was one of the major concerns that came up, the downshifting, because if you're gonna be in the classroom, you're gonna need to have PPE. Are there plexiglass partitions on the desks? Masks that are gonna be worn, the way that cleaning gets done. And this is, being a Lebanon City Councilor, I've experienced this before, where I've seen downshifting of costs to the local level. So who's gonna end up paying that bill? I actually think if we're being asked to reopen this way, and given these opportunities, that we should have assistance from the state. And as a state senator, I would push forward with that in an emergent manner to help our local communities and our school districts. Because this particular downshifting, it's never fair, but this is probably one of the most unfair blows that we've had in a long time, given the fact that this is a worldwide pandemic. Thank you.
Thank you, Sue. Beatrice, I'm going to repeat the question for you. It's a two-part question. The first is, should New Hampshire have had, I should say, a universal approach to the 2021 academic school year? And then the second part is, what resources should the state government provide to districts as they open?
Well, to the first question, it is a really very complex question. Ideally, it would be nice if everything were coordinated and happened, exactly at the same pace and with the same strategies. But that is a pipe dream. That simply is not reality. Reality is much more complicated, and those decisions have ended up being made by local groups, and local groups who had the best interest of their teachers and their children in mind. It is for that reason that, given the fact that there is such a great variety in communities, we have a variety of approaches. It's because in each one of those communities, people are looking at one particular example of, that return to school, and they're trying to do the very best with whatever resources they have. Not keeping the kids out of school is a serious problem, and it's a serious problem that impacts areas that go beyond education. It impacts areas like, school lunches. What's going to happen to the kids who normally have lunches in school? It impacts areas like, broadband. many children in this state, in many areas, in their wide areas, do not have access to broadband, and they certainly don't have it at home. Many of the libraries, which were the places where children used to go after school or when they had to do homework, are closed. Many of the public spaces where they could connect to the internet are closed. Thinking of broadband as being at a point in the state where it's going to solve the immediate problems of the pandemic is completely unrealistic. Deploying broadband is a complicated process, and it requires time. We don't have time. And because we don't have time, I think that the best approach is for individual communities to take a very close look at the reality they live in, enlist the help of the expert, the scientists, the doctors, and the teachers, and try to come up with the best solution. But even if they do come up with the best solution, there is a major issue that remains to be addressed. And I'll give you one example. The Lyme School, that's where I live, Lyme. I found out that the Lyme School was opening completely, and they're taking all the precautions that they can take, from the point of hygiene, social distancing if they can, and all those things. And they're getting support from the state. Do you know how much the support is? They're getting $8,000 for the year. I mean, that is just, it's unspeakable. The state is going to have to step up to the plate and provide the economic funds that are required for the schools to open safely. The schools are going to have to come up with individual programs and individual plans that make sense and that can be approved, and those plans need to be funded. And that needs to happen this year. It needs to happen from the legislature. Those funds need to be appropriated, and they need to be dedicated to address the kind of emergency that the educational crisis is creating for the families and for the schools and the teachers.
Thank you, Beatrice. So this is a moderator imposed pause because I need to get a charger for my phone. So it's right in the other room. I just need to excuse myself for 1 second and I'll be right back. Thank you. The next question pertains to equity, and Beatrice, this question goes to you first. And you had actually referenced, I heard, kind of inequity surrounding broadband availability. And so I'm going to speak to equity in a somewhat broader sense, which is that across the country, we've been having conversations about equity. They're on the rise, I would say. We've seen Black Lives Matter protests in every state, including New Hampshire. There's not, it feels like a month that goes by without an incident in the news with respect to incidents involving violence against peoples of color. And yet a couple of weeks ago, the first woman of color was named on a major party presidential ticket. So my question is to both of you will be, and to Beatrice, to you first, what will you do to advance equity in New Hampshire in your role?
Well, I think that we're talking about racism and we're talking about discrimination, and that both racism and discrimination are an integral part of the social fabric in America at this point. And I'm not saying that no progress has been made. A lot of progress has been made if we look 100 years back, but that doesn't mean that the problem has gone away. I think that what you see with the big difference now is that it really is out in the open again. Because for a few years, since the 60s, people grew under the kind of illusion, not Black people, other people grew under the kind of illusion that, things were really going well, and that, discrimination on racial grounds and racism in a broader way was a thing of the past. Well, that is not the case. Racism is real, and it impacts every aspect of non-white people. It impacts them economically, in the sense that they're often paid less than their white counterparts. It impacts them from the point of view of housing, because many times they're not allowed to buy houses that are the houses that they would want to buy, simply because they're not allowed to make offers on those houses. In fact, there was just an article that I read, I think in the New York Times a couple of days ago, and they were talking about a number of African-American people who had actually conducted an experiment where they had their house appraised because they wanted to sell it. I think it was in the DC area. Certainly one of them was in the DC area. And the appraisal came low. So they decided to get another company to do the appraisal, but this time instead of the owner, who was Black, being in the picture, he had one of his white friends. the appraisal went up by over $100,000. And there were more examples of that. And it's, I mean, it may seem humorous, but it isn't humorous, because it's another one of those tips of the iceberg that tell you that in order to fight this kind of bias, because I'm going to call it bias because it is so broad that it will cover everything. In order to fight that kind of bias, we cannot just, react to the recent murders of Black men, although we have to react now as we have in the past. We absolutely have to do that, but we have to do much more than that. We cannot just, demonstrate, hold signs and rest. We have to make sure that in every piece of the legislature, and that starts in Concord and it starts with us, we introduce mechanisms that completely undo the built-in racism that is already part of so many laws. And we have to do that right away, and we have to do it in a detailed and systematic way. Because in the end, the situation of Black people and of minorities is not a result of just, the different language or the different culture. It's a result of very clearly determined social and economic factors that are built into our laws and our practices. As legislators, we have to attack them from the base of the laws. And that's what I intend to do in Concord from the Senate.
Thank you, Beatrice. And the same question, Sue, to you. What would you do to advance equity in New Hampshire?
So I'm going to talk about equity in three different categories. I'm going to talk about it in terms of economic. I'm going to talk about it in terms of gender. And then I'm going to talk about it in terms of racial, because these are all areas where we see inequality throughout the country and in the state of New Hampshire. And it is structural. It is built into these systems. And the only way to bring about equality is to make very specific investments. So let's start first about talking about economic investments. This is about our employees. Okay, it's not just about raising the minimum wage. I mean, the minimum wage in New Hampshire is the federal minimum wage. We are the outlier in New England. It is about a livable wage. Is $15 enough? $15 per hour enough? I don't really think so. I think people still would be looking at having two jobs, but we need to invest. We need to raise the minimum wage. We need to have paid family medical leave. These are appropriate and good benefits for employers that start to level that piece of the economic playing field, that inequity that has been baked in. Second, when I talk about gender, I'm gonna be partial, and I'm gonna talk about women for a minute. This is where, and we know according to the New Hampshire Women's Foundation, that women are paid less on the dollar than men, that their career tracks, their ascensions through that are not as equal. And the kinds of investments that we need to make are going to be not only in making sure that, working to bring about fair and equal pay, but we need to protect women in other ways. And that would, be in fighting against domestic violence and sexual abuse. We need to protect the rights, reproductive rights of women. And I know I'm being very specific about women right now, but in terms of talking about investing in gender that way. And I like to tell a little bit of story here that when I was in high school, I was a student athletic trainer. That's where I first cut my teeth in medicine. And I went out on a playing field once to take care of a young man who'd been injured. And I had an older gentleman football coach tell me that little girls didn't belong there. And I never forgot that. And that was the force behind that drove me to being the first female chief of emergency medical services. And in New Hampshire, and I've worked in a male-dominated field my entire life. Last but not least, but so important right now, is talking about racial inequality. So Black lives do matter, and we have a role here. We have two roles. One is we have to continue to advocate, okay? We have to deal with the change of heart. We also have to deal with policy. And I think the number one way to deal with policy in a state like New Hampshire, well, in the nation, but I want to talk about here, is having an Office of Diversity and Inclusion, a place where we're looking at do we have diversity on our boards and commissions when executive counselors are looking at applications and making appointments that come forward? What about how contracts are awarded? What about employment? So there needs to be a comprehensive overarching policy that there is one person leading the drumbeater in the state to make sure that we bring about that, bring about all of these investments, but I'm highlighting this last one because we all know what's happening nationally. The light is very brightly shown, just like in my kitchen on me right now on this particular issue. And I think this is the most comprehensive way of addressing it, is putting someone in charge, making sure that we can invest appropriately. Thank you.
Thank you. Thank you, Sue.
Red, sorry. There was a red card up, but I missed it. Sorry.
All good. Let's see. I'm gonna pivot a little bit here. Sue, this question goes to you first, and it pertains to mental health. And New Hampshire was once known for having one of the best systems for providing mental health care for its residents, but now it's some would say slipped to inadequacy, where many get little to no access to adequate care, and the results fall heavily on our schools, criminal justice system, and families. And so my question is, what actions will you support to restore access to quality mental health care for New Hampshire residents?
I've seen this firsthand in working in an emergency department at Concord Hospital that was closest to the state hospital. And we saw that folks who were having, patients who were having issues with mental health were arriving in our emergency department, some that could have been in a more appropriate outpatient regional setting, but some that ended up in our emergency department for days and hours. We called them patients that were boarding, and it was not the best and most appropriate for care for them. In fact, I think it made the situation worse. So how do we invest in that? I think we invest in it in the same way we invested in a project, I believe, in the project where we're actually developing mobile crisis teams. We're not just doing this in the largest cities, but we're regionalizing this care, where we're partnering with groups like Riverbed Mental Health Services and West Central, as our partner here in the Upper Valley. We can partner with those groups. We can enable this through the legislature and have mobile crisis teams that are partnered up with either law enforcement or emergency medical services, whichever works best, and are going out into the communities, meeting the patients where they're at, making the best decision for the most appropriate either outpatient or inpatient setting, and then moving them towards that setting. We also know, and there was some money in the budget that we have right now to create more beds, more staffed beds for these patients. That's been a crisis for years. You can fill rooms with beds, but if you don't have the staff to take care of them, that's an issue. Increasing reimbursement for the providers who take care of these patients is an issue, because we have a problem bringing providers, mental health providers, into our state and keeping them in our state because reimbursement is low. So a program that would help them pay off their loans, would incentivize them to come into work in these kinds of systems, would also, I think, make a real difference in the state of New Hampshire. Thank you.
Thank you, Sue. And Beatrice, the same question to you. What actions would you support to ensure access to quality mental health care for New Hampshire residents?
Well, you started by talking about the fact that at one point in time, New Hampshire had one of the best mental health systems in the nation. And I heard that when I joined the legislature, and I said, I had to ask myself, because by the time I joined the legislature, that wasn't the case anymore, but it had been fairly recently. And the question, of course, is, well, how did that happen? How could we go from having one of the best mental health systems in the nation to having what I'm looking at right now? And I think that the simple answer to start with, not that it answers everything, is funding. I think that the funding was not what it should have been. I think that both mental health and addiction have been underfunded for a very long time, and that has had a tremendous ripple effect, both on the institutions and on the patients. Because on the institutions, the effect it has is that it creates tremendous bottlenecks, both in terms of admissions and in terms of discharges, because not only do a lot of people, because of lack of preventive care and out of hospital care, end up in the hospital, in the emergency room situation that Sue was just describing, that anyone who works in a hospital will know is exactly what's happening. But they also create a bottleneck in terms of discharges, because the problem is that not only there is not a place to take care of those people because they hit, that final skid that takes them to the hospital, but there is nowhere for them to go when they leave the hospital. So the hospitals can add as many beds as you want, unless you have a network of transitioning spaces with service with help, it's not going to solve the problem. That's the ripple effect of the situation in terms of the institutions and hospitalization, and then before and after. But there is another issue, and that's the fact that so closely that lack of resources, that lack of a proper, sturdy mental health and addiction system has effects that go well beyond the hospital, and it ties in right with criminal justice. Because the fact is that a lot of people who have mental issues and who are addicts end up being incarcerated, and that is instead of getting the treatment that they could have gotten before they went to the hospital or after they got to the hospital. So we have a big picture where the health issue just, expands into a big social issue and a big social justice and criminal justice issue. And one of the first answers is, funding. And in this sense, there is a bill that went through this year, Senate Bill 5, and that Senate Bill 5 does something very important, because what it does is that it increases medical reimbursements for addiction treatment and for mental health coverage. And I think that that's going to make a difference for the institutions, and if the institutions can, deal better with the overload, that's going to have, a beneficial effect on the curve of the patients. But it's not going to solve the problem. We need more than just that reimbursement. We need the before and the after. And right now we don't have the before and we don't have the after. So all the weight falls on the hospitals.
Thank you, Beatrice. Okay, so.
I think Sue has a question, Matthew.
Oh, I'm sorry.
Matthew, as you said, that Beatrice mentioned my name, and I appreciate it because you gave me an opportunity to follow up on something that you started talking about, which is the hub and spoke approach here in New Hampshire to dealing with addiction services. And so there is a connection between mental health issues and addiction issues. And Dartmouth-Hitchcock is one of the 9 different doorways into addiction treatment in New Hampshire. This has been primarily federally funded, administered by Health and Human Services. There are 9 hubs where folks who have addiction issues can come in, and then the spokes are the case management and the services that they receive on a regionalized basis. I think that these two come very closely together. They're intertwined. It's a program that is still underway. It's had some peaks and valleys, but it supports those regional initiatives like we see with public health. So the hub and spoke program, 9 different doorways in, and I know that Dartmouth has played a role in this as well. Thank you.
Sure. Thank you. I'm sorry. I should have, when we set the ground rules, we talked about earlier, if a candidate mentions another candidate by name, the other candidate has an opportunity to respond. I'm just giving the audience, the viewing audience, a heads up that as to why the format works the way that it is. So I'm looking at the clock just because I want to be sensitive to the time that we have allocated for ourselves. I know we got a little bit of a later start, so I'm hoping for 2 more questions. I'm gonna ask for one of them to be kind of a speed round. So I'm gonna ask Courtney to read the time available, but I don't think you're gonna need a lot of time to answer the question, okay? But so the first of the last 2 questions, and I'm starting with Beatrice, I think. Sue, your last piece was a response to Beatrice's comment in her second piece. Is that correct? Am I on track so far? Okay, so Beatrice, climate change. Climate change has been a hot button issue in national and local races. Some are hesitant to make changes to industry regulations that would address climate change. Others are discussing big changes that they would make to curb climate change. How do you prioritize climate change, and what policy changes would you advocate for?
Climate change has been a priority for me from before the time I joined the legislature in 2008. That's why I worked on climate change from the very beginning. I worked on energy efficiency bills, and I worked on renewable energy bills. I supported RGGI, and I support the increase of the RPS. It was a productive track, and I actually got very important legislation through in all of these areas. And I'm planning to continue working in the same area. I think that it has to be a multifaceted approach. I think that we need, look, at least you have to look at two sides. One is the production of energy. The other side is the consumption of energy. If you look at the production of energy, the key issue is how to transition from fossil fuels to renewables, and how to do that in such a way that we meet our goals of carbon neutrality and complete transition by the benchmarks that we have adopted. It could be 2030, hopefully, and it may be a little later, but we need to keep in mind that this is a true and real emergency. The other side of the picture is the consumption of energy. And that's where all my energy bills come in. They're energy efficiency bills, and they are the mechanism that brings together a number of things. It brings together the community, it brings together the individual, and it brings together climate change. Because if you think about the kind of energy efficiency bills that I created, what they do is that they provide a mechanism that allows the municipality to be in control of the development of energy efficiency by bonding and lending the money to the individual property owner, so that the property owner can retrofit the house. In retrofitting the house, he uses much less energy, and that has a beneficial effect on the environment. So the cheapest energy is the energy that you don't use. The most emission-free energy is the energy that is not being produced. And that is the philosophy behind that second important part of the climate change picture that I have worked on while I was in the House, and that I will continue to work on in the Senate. But this year, a number of very important things have happened in the Senate. Unfortunately, they've been vetoed in most cases, but I'll just finish. They have to do with net metering, the expansion of net metering, and they have to do with the expansion of the RPS. And that is something that we've been trying to do for many years. We will continue to do it from the Senate.
Thank you, Beatrice. Sue, the same question to you with respect to your policy changes with respect to climate change.
Sure, thank you. So climate change is about justice. It's about a burden that we're putting on not just our children, but into the future. It is the reduction, turning away from the use of fossil fuels and turning full-facing to renewable energy sources. I talk about this often in a two-prong approach. One is unleashing the power of local government. It's what we have right now, and really the only comprehensive local tools to deal with fighting against climate change. This is the real time where we're talking about thinking globally and acting locally. So in Lebanon, we have worked with Revision Energy to put solar arrays on 8 municipal buildings to generate up to 30% of the power for those buildings. We have a methane reclamation project where we're taking a dangerous greenhouse gas out of the air, and we're turning it into energy for the landfill. We also have provided a property tax exemption for homeowners who put solar systems on their houses. Those are just some of the initiatives that local governments can put in place to fight climate change. But on the statewide basis, we've had a climate action plan in place, I think it was 2007 under Governor Lynch, but the climate action plan hasn't been legislated. There isn't a comprehensive overarching policy that ties all these pieces together. And that's where I really want to spend my time, is in moving towards a Green New Deal for New Hampshire. And I've said this before, and I'll say it again. I think, we are a regional outlier. We are lagging behind. And we have opportunities to do something like the state of Maine did with a freshman legislator who struck a Green New Deal that brought green jobs. So it looked at a reduction in greenhouse gases. It brought green jobs, encouraging green jobs in New Hampshire, in Maine, sorry. It has created workforce development tracks with apprenticeships. So you can start working in a green job field while you're in school and come out on an apprenticeship track and move into that career. It brings solar to new school buildings. And they did this all in cooperation with labor, with the AFL-CIO. So this is a win. We see this as a win-win for everybody and the kind of direction we want to go in. I also want to tie back to one more thing. I see red coming, which is the Transportation Climate Initiative. We talked about transportation earlier. We're one of the states that's not in the Northeast that has not joined that, which I think is very strategic, especially if we're going to support electric vehicle and fast electric vehicle charging stations so we can reduce emissions when people travel. Like when my daughter drives from Virginia to New Hampshire. I'm done. Thank you. Okay.
Thank you. So, okay, so this is literally one that I'm going to just ask Courtney to go directly to the yellow, because we're only going to do 30 seconds for the last question, and then we're going to go to closing statements. Okay, so you just mentioned transportation. So, Sue, this first, and it's essentially New Hampshire, of course, is one of the few states, maybe the only state, that doesn't have a mandatory seatbelt law for those over 18, a front passenger seatbelt law. Would you support it?
I would. We're the only state in the nation. I talk about it every day in my full-time job with the Trauma Society. Leading cause of death between ages of 1 and 44 trauma. Motor vehicle is the leading mechanism behind those causes of death. Yes, I would support that. Thank you.
Thank you, Sue. Beatrice, same question to you.
I would, and I would add motorcycle helmets because I think that we're talking about two clear cases where, yes, it should be a mandate. Yes, it should cover everyone. Yes, if it has to come from the top, let it come from the top.
Great. I can't thank you enough, both of you, for participating in this conversation and your willingness to join us and to share your time with the employees and community of Dartmouth-Hitchcock. This will be made available on our website, and it will be, we'll share that with your campaigns. And so I just wanted to say thank you before moving on to the closing statements, which I think it starts with Beatrice. There are 3 minutes for the closing statement, followed by Sue. So Beatrice, thank you.
Thank you, Matthew. Well, I am running for the Senate, and let me tell you something. The Senate is not the place to learn the ropes of the legislature. The House is the place to do it. And that is why 5 out of our 5 most recent senators have all spent considerable time in the House. Peter Gerling, Clifton Billow, Matthew Hood, David Pierce, and finally Martha Hennessy, and hopefully me after them. I am the only candidate in this race who has that kind of experience, and that experience is really important. And you don't get it just by advocating in Concord, by lobbying in Concord, or by testifying at hearings. You have to learn that experience in the legislature by legislating. And that's something that you only do as a legislator. You have to learn the ropes of legislating, but that's not just learning the nuts and bolts of, you know, how to run a bill through the House and through the Senate. It's much more than that. It means that you have to acquire a different mindset. It's what I call the long vision. It means that you have to step back from the local interests of your community, and you have to see the whole picture. You have to see the district, you have to see the state. And unless you do that, you cannot really legislate effectively for your whole district and for everything. And in fact, if anything, being very closely tied to local politics and to local interests is a real hindrance when it comes to acquiring that long vision that I consider so essential to the job of legislating. I'll give you a quick example. I hope I have time. Northern Pass. Northern Pass seemed like a good proposition. The town of Franklin was all in. They really wanted it because they were getting $30 million in extra property taxes. And you can imagine what a small town can do with $30 million in property taxes for education, for transportation, for infrastructure, you name it. It went to the House and to the Senate. And you know what? It didn't work. And it didn't work because the town of Franklin was right to advocate and to come to Concord and to send their officers and everything to testify and to try to convince us that that was the right thing, because it was the right thing for them, but not for anybody else. And that's when in the end decided the issue, because that's what the House saw and that's what the Senate saw. So this is a case that shows you how that kind of skill that is very valuable at the local level does not translate easily into legislative skill. My record shows that I don't have those entanglements, and it shows that I don't have that close tie to local politics and interest. My energy bills, my broadband bills, they were for everyone. They were not for the communities where I live or that were associated with where I live. They were for everyone else. And I think that we need a senator who truly cares and works for every community in this district. I think that we need an experienced senator who will know how to do it and who will be ready to hit the ground running on day one. I think I am that senator, and I hope you will support me. Thank you very much.
Thank you, Beatrice. Sue, your closing statement.
Great, thank you. And again, thank you for the opportunity to be with you today. I first wanted to point out before I move forward that New Hampshire is made up of 234 cities and towns that are the backbone of the state, that make up not only who we are, but what we do and who we serve as a state senator, not just for this district, but for the entire state. But moving forward, I think you've heard today that I have broad experience dealing with issues from infrastructure to property tax relief, to anti-discrimination, to fighting climate change, and investing in renewable energy sources and much more. Over 11 years as a city councilor and a mayor, I built a broad range of experience suited to dealing with a broad range of issues similar to those that come before a state senator. You are a generalist. You work on issues from, again, renewable energy to infrastructure. I also have very deep experience in a specialized area that is well suited for this particular time of COVID-19. For 30 years, I've been in the field, in an emergency room, in an emergency operations center, or at a desk managing crises and protecting the public. I know how the state's healthcare institutions and public health networks function. And as your state senator, I'll be in a position to help ensure the rapid deployment of COVID-19 vaccine when it becomes available. My deep experience in this area is vital at a time like this. I'm also really proud that I bring people together who don't necessarily agree with each other, but who are all focused on solving a problem. Flu vaccine protocols, the Westbury Yard Project, developing an electronic patient care reporting system for EMS, and procedures for equalizing patient care treatment throughout the state, passing legislation in New Hampshire and in 8 other state legislatures. I have a long record of results over the course of my 30-year career, which has been possible because of my ability to work with people to get the job done, regardless of who they are. I bring a breadth of experience and on a wide range of issues, and my depth of experience in public safety and healthcare and in crisis management, and my skill sets of bringing people together to achieve results will work for the New Hampshire State Senate. Protecting the public has been my life's work. Fighting for justice, fighting for equality, and the protection of the most vulnerable in our communities is at the center of the decisions that I've made, not just in Lebanon, but working in state government. I have made these decisions and will make them as your next state senator. Earlier, I congratulated DHMC on an important milestone, and that's the 1,000th organ transplant. But the work you do here matters. DHMC, this institution, is one of our largest employers in New Hampshire and is a significant stakeholder in our state's economy. The work that you do here matters, not just to our state economy, but to thousands of families, people who come here for cancer treatment, for highly specialized surgeries, for emergencies, for trauma care, for routine health care, for labor and delivery, and for end-of-life care. What happens here at DHMC affects us at the state level, but also affects the families in the most important and at times very intimate ways. I'm extraordinarily proud that this world-class institution is located right here in the city of Lebanon and right here in Senate District 5. I'm prepared to be your voice in the New Hampshire State Senate, and I'm asking for your vote on September 8th. Thank you.
So I once again want to thank both candidates, Sue, Beatrice, both very much for joining for this conversation. Courtney, thanks so much for your timekeeping. Again, Angelica and others behind the scenes for making this possible. It's genuinely my pleasure to participate in this conversation. Again, thank you both.
Thank you so much. It's been a pleasure.
Absolutely. Thank you. Matthew, Courtney, Angelica, Beatrice.
Great job with the cards, Courtney.
Oh, good. Thank you so much. Thank you for being here.
Thank you.